Hello and welcome to week 2 of PA213. We are in your pharmacy technician certification review book, and we are in chapter 23, which starts on 246. We're talking about pain management agents, non-steroidal anti-inflammatory drugs, and they are also called NSAIDs, or abbreviated NSAIDs. So that is one abbreviation that you will need to know for the certification exam. So commit that to memory. NSAIDs, just like it is pronounced. All right. So I'm just going to go through the chapter with you so that you know what to look for. Some just bonus things that you'll want to know about NSAIDs is that ibuprofen, aspirin, naproxen, those type of drugs, mostly over-the-counter medications, are NSAID medications. And then also that anytime that you are dispensing a medication with an NSAID in it, or you're talking to a patient about NSAIDs, that you will need to remind them to take it with food because it does dissolve in the stomach, and so it can be very hard on the stomach. There's also COX-1 and COX-2 NSAIDs, and it goes on to talking about some of that. So I'm going to get into the chapter with you. Another abbreviation you will need to know is ASA, which is aspirin, IBU, which is ibuprofen. Those are just abbreviations for that. Okay, only COX-1 and COX-2. So moving on to the next page, only COX-1 is responsible for platelet aggregation and cytoprotective effect in the stomach. So like what we were just talking about, it dissolving in the stomach, COX-1 is responsible for that. Platelet aggregation means that it thins the blood. So anytime a patient is having surgery, they're not allowed to take an NSAID 7 to 10 days before surgery because that's how long it will affect. And that's why they're also prescribed aspirin 81 milligrams for people who have maybe had a heart attack before or high blood pressure to thin the blood a little bit so that it keeps that blood pressure down. Choice of drug, let's see, for COX-1, does it go into talking about that? Reduces inflammation, that kind of stuff. The drugs available, ASA, salicylic acid or aspirin. Should remember that. Some people have an aspirin allergy, and so if they have an aspirin allergy, probably they cannot take any other NSAID medication. So any ibuprofen, anything with ibuprofen in it, anything with naproxen, that kind of thing. My husband has an NSAID allergy, and so he can only take Tylenol, which is APAP for the abbreviation for that. Okay, ibuprofen, ketoprofen, those are all the all those type of medications. Okay, here we go into Tylenol, APAP or acetaminophen. Make sure that you can pronounce that. These are the non-steroidal pain relievers. So Tylenol is not an NSAID. I can tell you that that will probably be asked on the certification exam, so I would put that to memory. A lot of Tylenol is in narcotic analgesics. Analgesic is always a pain-relieving medication, or even opiates. So it can come in morphine, Demerol, those kind of things. Fentanyl, these are all the non-steroidal. Fentanyl, something that you'll need to remember about that is it is a patch, a transdermal patch that people put on their skins to help it, subdermal patch, so it will go through the skin. Going into oxycodone, hydrocodone, which does have Tylenol in it. You must remember that Tylenol can only be taken every 4 hours, so anything with Tylenol in it, such as a hydrocodone and Tylenol or an oxycodone and Tylenol, can only be taken every 4 hours because the toxic to the liver with Tylenol. All right. So what I would take out of when they're listing all these medications, make sure that you know, like Duragesic is the brand name for fentanyl. Hydrocodone and acetaminophen is the generic name for Vicodin or Lortab, and that you know that there are two different medications in them, and that they come in two different strengths. So, for example, 2.5 milligrams per 500 milligram. Tylenol is dosed at 500 milligrams, so that is the second number, and they'll probably ask you about that. You'll need to know some of how it works. So, methadone, for example, 5 to 10 milligrams. You probably remember methadone from a very popular case. Anna Nicole Smith was actually found methadone in her system when she died. It has a long duration of action. It is used in therapy of opiate addiction. So she was actually came out that she was addicted to opiate medications, and so they were using methadone to tone that down. When dispensed as an analgesic, it may be dispensed by a licensed pharmacy. It does not produce a euphoria or a addictive behavior, and it is a C2. And so typically with a C2 medication, the reason it is defined as a C2 medication is because of how addictive in nature that it can be. So C1s, remember, those are our street drugs. We do not see them in the pharmacy. C2s are high opiate pain medications like this methadone, like the Percocet. You see that they're dosed, classified as C2, so you will need to know some of that. Then going down to C3 is your Vicodin or your Lorcet. Tylenol 2, 3, and 4 are also C3. So those are just some things to, when you're going through this, to read over and to commit to memory. I also wanted to talk about tramadol. It is Ultram or Ultracet, which has Tylenol in it, but it can be one that if they are allergic to an NSAID, they can give tramadol as a medication because the Tylenol maybe isn't working, so then that's the next step up. Because it is not a controlled substance, it can be before they get into a controlled substance. So tramadol is usually kind of sometimes the dentist will prescribe it and that kind of stuff. And sometimes even after a minor surgery. All right. And then that ends our chapter and going into the chapter review questions. So make sure that you do answer those so that you get a little bit of practice on that. And I see that there are some prescriptions written out. Make sure that you also practice those as well, because it's really interesting to be able to read prescriptions at this point. All right, I hope that you guys have a great week, and let me know if I can answer any questions. I'm really excited that you're reviewing for your certification exam, which means you really need to think about when you're going to take your certification exam. If you're in the state of Missouri, I can tell you that you can take them at testing centers really close to where you live. So I would get on the PTCB, Pharmacy Technician Certification Board.org, and look up your location, and that'll tell you where you can take it. You can select a test date. You can also take a practice exam. I think it's $29 or $30, something like that, to take that. So if you need help in that, please let me know. I think that everyone should be a certified pharmacy technician because it means that you get the most pay than a pharmacy technician without it. And it will show that you are really serious about this pharmacy technician career. All right, I hope you have a great week, and I'll talk to you soon.